The subjective assessment. The learning objectives for this lecture will be to understand the concept of a subjective assessment, to understand the components of a subjective assessment, and to develop your clinical reasoning skills. What is the role of the subjective assessment? The subjective assessment is used in any assessment of a client on the initial examination. It is a way of assessing the spoken element of the client's problems. There are various aims and roles of the subjective assessment, and the first one is to identify the source of the symptoms, where the pain is coming from. The second one is to find out what factors are contributing to the condition, such as environmental issues, emotional issues, psychological factors, genetic factors, etc. It is also important at this stage to determine if there are any precautions or contraindications to the examination that might preclude the patient from going forward into the objective assessment. It is useful also at this end of the subjective assessment to form in your mind a prognosis of the condition, i.e. what stage of pathology they're at, how serious the condition is in terms of severity, and how the interaction of the personality of the client may affect your onward progression of treatment. Identifying where the focus of the physical examination should lie is another role of this subjective assessment, and this means using your clinical reasoning skills in order to be able to determine what physical tests should be used in the objective assessment. And finally, it's useful to formulate a working hypothesis of the problem. What skills do you need for the subjective assessment? You will need to develop some clinical reasoning skills in order to determine where your objective will be going. You need to develop a good communication, such as the way that you ask questions and how you both verbally and in a non-verbal communication. So, for example, asking specific questions, not asking 2 or 3 questions at a time, and being quite specific in your questioning. The final thing for the skills for the subjective is to be able to listen to the client and to note down what is effective and what is useful to you, but also to steer the client and make sure that they don't tend to waffle on. So what components are there within the subjective assessment? And this overview gives a brief summary of the titles that you should consider when you're doing any subjective assessment prior to the objective assessment of a client. First of all, you will need to introduce yourself. Secondly, the patient profile. There will also be involved a body chart, symptom description, the behaviour of the symptoms, the history of the current condition, the past medical history, some special questions, and finally your SIN factors, which is forming your hypothesis for the objective assessment. Let us now go through those in more detail. First of all, introduction. There will be an element of small talk as you introduce yourself and you find out a little bit about them. All the time there will be a lot of non-verbal communication during this introduction, where you'll be watching how the patient moves, how they sit, stand, and their the way that they sit may be indicating that they may be depressed. They may sit in a difficult way. They may prefer not to sit if they've got some sort of back problem. So there's an element of small talk which will involve both verbal and non-verbal communication. You may also start to discover a bit more about the patient with some details concerning the patient and their profile. And the details that you will need to collect are things like their name, their full name, their address, their date of birth, and some contact numbers. It's important at this stage to collect date of birth and name in order to be able to determine if they do have x-rays, MRIs or further investigations, that you will be able to find them if you phone up the hospital where they had those MRIs or investigations done. You may also start to move into the patient profile, and this will follow on naturally from their introduction that you start with. Some patients will be keen at this stage to tell you about their problem, and you may have to sidestep this patient profile and gather them more information about themselves towards the end of the subjective assessment. But it's also useful to note this at some stage. The age of the patient. This will lead you to alter your prognosis. So if they're older, then their physiology will be different and their ability to heal will lengthen. Their occupation, does it affect their movement? Does it affect their the way that their injury and their pathology? What about their sport? What do they do? At what level? How many times a week? Do they train? Do they play? Etc. Their family. Have they got any genetic issues with their family? Are there any inherited diseases that need to be considered? Is their family supportive as well? Do they have any parents to look after them, or do they have any other family support? This is important in determining the psychological factors surrounding a problem. What are their hobbies? Do we need to consider that their hobbies may be interacting with the pathology that they're presenting with?